Good day and welcome to Healthwatch Luton's AGM for the period 2019 to 2020. This is of course now late in 2020 and life is somewhat different to what it was previously. Our last AGM was held in a nice sunny warm July, and this year we are in a little bit cooler and wetter September, October time for our AGM. Housekeeping rules, I guess, don't apply because anybody looking at this should know where their own toilets, etc. and emergency exits are. COVID-19 has only been present for 2 months of the year 2019 to 20, but it has obviously influenced the current situation incredibly. The annual report covers the activity from April 2019 to March 2020, and that annual report can be found on our website, although Lucy, our CEO, will be covering some of the detailed aspects of the year for you later on. We started the year with vacancies in the staffing that we felt we needed to carry out our activities, but filled these in a relatively short period of time. And I do have to say we have a tremendously dedicated, gifted and wonderful group of people on our staff. I have to thank all of them, from Lucy, our CIO, who won an award for Community Business Leader in Luton, Lisa, who's been a massive strength to the project side, and Sudha, who's been a real star in looking after the volunteers. Abby and Moon supported the social media and many other back office functions, and Karen joined us in our engagement officer and supported our connection with the community. Our social media obviously in this time has been incredibly important, and Abby has done a sterling job in that. Without these dedicated staff we would not be able to carry out our role. Our volunteers are a small but dedicated and able group of people who add enormous value to our work, and a great amount of thanks has to go out to them. Healthwatch Luton won an award as the #1 in the country for its community engagement from the Healthwatch England network, and the volunteers were highly commended in the Sheriff's Awards for Luton last year as well. So we're not short of capability, ability and skill in doing the job that we have to do. There is no question of the dedication that we all have to helping give the public voice and weight in influencing the services provided in health and social care in Luton. We work together with the CCG, that is Luton CCG, and now more recently the CCG for the Integrated Care System, to include Milton Keynes, Bedford Borough and Central Bedfordshire, and Luton Borough and Council, to ensure that your voice is heard and the best possible provision is made. We feed back to the providers of care, to the community, and we also feed up through the network to NHS England and on to government. The year ended with the COVID-19 situation, and this has meant that we have had to adapt and demonstrate flexibility in the tasks at hand. We have done that and strive to ensure that the public have been heard in these difficult times. I have to thank everybody for their support and cooperation, and look forward to more stability in the future. Our thanks go to the staff within the Luton Borough Council and the Clinical Commissioning Group, all the providers and key workers around who have listened to what we have had to say and who have helped us in being able to perform our role as life goes on. I wish you all well, and hope that we all continue to progress through this current situation and get back to some form of normality. Thank you.
We published our report in 2020 this year on all of our activities, and that gives you a real insight into everything that we come across throughout the year and everything that we signpost, provide information and advice to, and also highlight particular areas of year-long projects that we've been doing. In 2019, we actually spoke to more people than we ever have done before, and the top 4 areas in Luton that people give us feedback have not changed very much actually in the last few years. GP access, as you can see, is still one of the highest areas, and it's particularly negative around people struggling to get hold of their GP. We also have feedback on Luton and Dunstable Hospital, which is mainly around outpatient appointments and referrals. The mental health provider also receives quite a lot of feedback throughout the year. This is mainly around inpatients, some also in the community setting. And then last year we actually had an increase of dental feedback. In 2019 it was mainly more positive overall from all of those providers and others, although there was still an increase in overall negativity of feedback, and that's generally around access to services. What we provided in our annual report was sort of a highlight of who we spoke to in 2018 and who we spoke to in 2019. And as you can see, we had a real increase in not only our targeted engagement, which is those people that we speak to out in the community, but also with our overall engagement, which includes social media, our website, and people giving us feedback either through emails or phone calls, or through our website direct. We decided in 2019 to actually focus on two particular areas in more detail, and we focused these areas on the feedback that we gathered in 2018, and that was mental health and also learning disabilities. And there is another video that Lisa Herrick, our project officer, will go through in more detail on the impact of these 2-year-long reports. What was really important about this work was that we'd never before spent so long with providers and commissioners and engaging with so many people on one particular topic, and it gave us real insight into how these providers run their services, but also has had one of the largest impacts that we've ever had on those services. So this is something that we'll continue to look at for 2020 and beyond. Throughout the year, apart from those 2-year-long projects, we obviously did lots of individual areas of work. We ran a Phyllis Theatre production at the beginning of the year, and this was for health and social care professionals. And that was really to highlight the difficulty of the patient perspective on care homes and adult social care in later life. We also reviewed some work around Roma travellers, although we did place that on hold as other Health Watch were looking into that in more detail, but that is something that we will pick back up. Health Watch also have the right to enter and view NHS contracted services. So we actually did quite a few enter and views in the hospital on various wards and reviewed the enter and views that we'd done the year before. And with our mental health and learning disability projects, we did lots of smaller interviews and reviews, all of which we have published reports on, which you can see on our website. As part of the Health Watch network, all Health Watch took part in the NHS long-term plan engagement, and in Luton we focused on cancer and mental health, and we ran a series of surveys and forums, again all of which feed into the NHS sort of plan in which to engage people and deliver services locally. We also developed our team in 2019, so we actually grew from 2 or 3 of us into a staff of around 6, and that has really helped us reach so many more people in Luton. We've carried on our internal development, particularly around our volunteer training and board development. And one of the more wonderful things last year was we actually became an award-winning Health Watch. So across the network, out of 150 odd Health Watch, we won an award for an event that we ran for young people in 2018. From the feedback that we gathered in 2019, we decided in 2020 that we would focus on mental health in the community setting, but also really tackle with the transformations that are coming in for primary care on GP access. But of course, COVID-19 happened, and in March 2020, our work plan for the year changed somewhat. So we started to shift the way that we worked quite considerably. We moved online very quickly, but that is something that we are reviewing constantly. And we created in April a How Are You Doing campaign. So this was a focus to gather feedback from Luton residents on any health and social care, but how they were really feeling about how it was working for them. Alongside this, we ran a GP observational report, a care home observational report, and we will be looking at a dental observational report. We've also done an engagement forum on hospital discharge, particularly around the COVID period, and we supported the local authority in setting up their communication hub right at the beginning of the pandemic, which was a very instrumental part of communicating to the Luton residents. All Health Watch were asked to set up a page on their website to support local public health communications, and our website does hold all health and care publication from government guidelines to NHS to the local information being sent out. And we're also looking at running more engagement forums throughout the rest of this year, but obviously looking at some areas such as digitally excluded. These are people that have not been able to move as quickly onto the online forums as everyone else seems to have done, and we need to ensure that those voices are heard and carried forward. So every month we produce feedback reports for the health and social care system, and we also create thematic quarterly reports on how health and social care services are managing during this COVID pandemic. So throughout the rest of this year, we will just continue to support the system in any way in which we can, and we will continue to gather feedback from Luton residents and make sure that people feel supported and understand what they should and should not be receiving during this period of time. There's plenty of ways that you can still be involved in Health Watch, which is mainly by giving us your feedback. But as we have moved into the digital world, we are more than welcome to accepting applications for new volunteers or board directors. So it'd be wonderful if Luton residents could join us in ensuring that their voices really do help shape the services that they receive.
So hello again, and to cover the finances in respect of the year 2019 to 2020, our costs were 136,000 to provide the services that we provide. 70% of that cost was allocated to staff. Staff obviously are the main backbone to carrying out our function, and that has to take the majority of the funds that are available to us to perform those duties. 15% of that amount of money went to premises and professional services like accountancy, etc., and our premises up at Base Point. IT and communications covered a further 9% and 5% for meetings and events. We have to go out to meetings and cover events, and we try to keep those costs to a minimum whilst engaging with the majority of people that we need to try to engage with, and the other 1% is covered by various ancillary things. So 136,000 was the cost incurred. We get a grant of 119. The difference between that and 136,000 cost was funded from a carryover of a small amount from the previous year's finances, and a small amount of additional grant function that we got for specific events and activities. So that is our finances for the year 2019 to 2020. Thank you.
Hello, I'm Lisa and I'm the Project and Support Officer for Health Watch Luton. Today I'm going to talk through with you the learning disabilities and mental health overviews of the projects we carried out last year. So we carried out two projects, one looking at health and social care services from the perspective of a person with a learning disability and or autism or their relative or carers. And we also looked at mental health services that are available in Luton and tried to understand the experiences of those that had used the services or those who were the carers or had responsibility for people with mental health services in Luton. The Champions and Challenges project was we wanted to hear more from those who were living independently in Luton with a learning disability or autism. So we carried out several activities. We carried out a baseline survey. We held a professionals forum where we spoke to professionals who worked in the area of learning disabilities and autism. We held a public forum where we spoke to some parents and carers of those with learning disabilities, and we also spoke to a few people with learning disabilities themselves at that public forum. And then we regularly attended the Learning Disability Partnership Board, which was held in Luton, and we presented at that a few times and we used it as a forum to gather some feedback. We spoke to around 130 service users and carers during that time, and we also managed to speak to professionals in that time as well. We made 18 recommendations system-wide, and we made some specifics to certain organisations. We found that the main themes people were talking about was the staffing, so having the staff in the right places, access to different services, the annual health checks, integrated care, and understanding and knowing criteria and definitions for a person with learning disabilities and how to access services. So we found that staff being in the right place at the right time and carrying out the right roles was really, really important for people. Some family members told us that they felt that there weren't the right people at the right time for them when they needed them. The annual health checks are for people who are age 14 and over who have a learning disability, and it seemed that there was quite a lack of understanding of the annual health checks and also a lack of actual carrying out of the annual health checks. The accesses to services was quite tricky for some people, and knowing what was available and where they could get the support for those services, and also knowing what assessments were needed and what criteria people needed to be able to access the services. It was felt by some that there wasn't a very joined up approach for individuals, so they might be open to several different services and there wasn't actually the right people telling them or helping support them at the right time. The definition was quite important, so we found that whilst we used a definition from the Department of Health and local authority, this definition wasn't exactly what some people felt was right. There were some family members that felt things should have been included, and equally there were some that people felt shouldn't have been included. And listening, so hearing the voice of everyone, so not just the individual but the voice of the parents and the carers at a time when they really needed it. The recommendations we made were quite extensive, but they did include transitions, so when people are transitioning from children's services to adult services and knowing what to expect, and also the transition starting soon enough. Annual health checks we feel need to be carried out, and it's making sure that they are carried out. The sharing of best practice between different organisations, so for an example, Luton and Dunstable Hospital have a fantastic learning disability policy in place. However, that's not the same across all organisations, and so it's perhaps pulling different things and having a look and seeing how they could work better. Health action plans aren't really used by people, and so people don't necessarily know what their purpose is, and it would be useful for them to be promoted. People felt that there wasn't enough employment or voluntary work for those with the learning disability. It was felt that SENCOs within schools and support staff needed perhaps different training or to ensure that there was regular training. A needs versus a diagnosis was quite important, so getting support for the needs, not just after you've had a diagnosis. And also once you've had that diagnosis, signposting and follow-up and appointments afterwards would be quite useful for people. People felt that they weren't necessarily seeing the same professional, so they were going to have to start over with their story or their experience, and so it can be quite helpful if people, where possible, could see the same professional and then maintain those relationships. Parent Carer Forum is currently being looked at locally, but it was felt that there wasn't really much promotion or involvement of that in society and in the community. There's lots of boards that happen, but there isn't always great participation because they're not necessarily in the right place or they're not promoted to the right place. So for example, Think Autism Partnership Board is something that is county-wide, and during this project it was actually discussed at a partnership board meeting, and it was decided that there will be more local meetings to happen and they would be area specific, so rather than being across the whole of the county there will be some for Luton, some for Beds and some for Central Beds. It was felt that there could be an information card that people could carry so that when they go into a doctor's surgery or an optician's they can pass this card over and it just says, please have a look at my notes, I need a little bit more help. The EHCPs, there was not always the support if there was a need for translation or understanding some of the questions, and so it was felt that perhaps there ought to be some more support, some more assistance when people are filling in the questions for the EHCP, and also knowing who is entitled to one and how to go about having one. And the same could be said for criteria and referrals. It's just knowing and understanding the processes and making sure that people are aware of the expectations. So you get referred on this date, these are the guidelines, this is what happens next, this is the process, and so that people know what to expect. So since our project, there has been some impact, some immediate impact and some longer term impact. In the immediacy, there has been a neurodiverse strategy that is being created and worked on with Luton Borough Council, and Healthwatch are a partner organisation within this. We have dedicated a member of staff who will be trained to be a leader reviewer, which will be able to help support the programme locally. There was a conversation where it was agreed by Power and the Commissioners for Learning Disability Services that they will work on transitions, and there will be a separate work stream for that. We as an organisation have created easy read leaflets, and we are also working on targeted engagement going forward for those who otherwise would not necessarily be heard. And that's something that we started during the project, and it's something that we hope to continue on. So what's next? We will be reviewing our recommendations. So we created a RAR, which is a recommendations, actions and review table, and we'll be reviewing that and looking at how things have developed over the last year and what we can do to help support the changes. We're going to continue to be involved with the Learning Disability Boards, including the Learning Disability Partnership Board and the Think Autism Board. We will continue to gather feedback, specifically for those with learning disabilities, and carry out targeted engagement in the areas where we can, once obviously COVID has subsided slightly. And we will continue to support the local authority and the Luton Clinical Commissioning Group with learning disability and autism services. So secondly, the other project we worked on last year was around mental health services and knowing and understanding what services were available and how people were accessing them. So we carried out several activities in that area. We had a baseline survey, we visited the wards, we carried out professional forums and public forums. We also attended some inpatient meetings where we held forums and spoke to inpatients. We carried out interim views, which are a statutory function of Healthwatch Luton. We did some long-term plan work. We held our AGM and we gathered feedback at our AGM, and we also were involved in case conferences for mental health patients. During this project, we spoke to around 250 people, which was staff and members of the public who access services. We carried out baseline survey, as I said, we got over 100 responses for that. We were able to attend various different meetings across Luton for mental health services, including the Reimagining Mental Health work that's happening. We made 36 recommendations system-wide, and that does not include the recommendations we made for the interim views. And the main themes tended to be perception, so what people perceived would be happening, communications, integrated care, access to care, aftercare, and also there was some safeguarding that we became involved with. So the key findings: the staff who work within the mental health services are very, very aware of each other. They work really, really well together, and there's a real strong cohesion between all of the staff that work for the different services. We found that communications, people weren't 100% sure of who was speaking, when they were speaking to them, how they were going to speak to them. So that became something that was quite interesting to try and understand. Personality disorder, so that in Luton there is not a specific complex needs service, nor is there a specific personality disorder service within Luton, and this is something that was not commissioned specifically for Luton. The aftercare, so people felt that they were unsupported once they were discharged, and there was uncertainty about what would happen when they were discharged, how they were discharged, and also some felt that they were medicated when they were discharged, or they weren't sure how they could get their medication. There was an uncertainty of who people should contact and when they should contact them, so there needed to be more of an integrated approach. Perceptions of individuals for treatment and care was something that came up time and time again, whether that was in the community or within the mental health wards. And so, for example, a gentleman told us that he felt that he had reached rock bottom, and that is why he had been sectioned and was an inpatient, but he felt that what the treatment he was receiving on the ward was not what he expected. Accessing CMHT, so the community mental health teams, it was felt, some people felt that they did not get enough contact, whereas other people felt that they didn't know who they could contact within their CMHT. There was a number of safeguarding alerts that Healthwatch Luton were involved with, and some that we had to bring up ourselves. And then on the wards, each ward is encouraged to be individual and for the people that are on that ward, but it seemed that there wasn't always the sharing of best practice on those wards. The recommendations we made included the following. So we recommended that there was a specific service for complex needs and also personality disorders. We felt that post-discharge, inpatients needed to know who their GP contact was, make sure that the communication was quite strong between the GPs and the ward, and also a comprehensive discharge pack. So some wards gave a patient a small credit card sized information. Other wards did not give any information other than a discharge note, which wasn't always available when they were discharged. Inpatient ward activities and community meetings. So the activities that happened on the ward, some patients felt that they weren't told, or they didn't go ahead, or they weren't as they expected, and also felt that they couldn't speak up at community meetings. So one of the things we recommended is that there was a post box put on the ward so that people could put their recommendations and their feedback within that post box. An opportunity to share information. So quarterly meetings of organisations to share information about high intensity users and making sure that people, local, smaller, perhaps third sector organisations, are aware of what is available to everyone. Better communication, so carers support. The carers that we spoke to didn't actually feel that they were getting any support from anywhere. So a better communication between the wards and the carers of those individuals on the wards, for example, would be quite good for people. The Recovery College, when we carried out our baseline survey, only 7 people knew what the Recovery College was. So it's a very, very good service. It's open to everyone in the community, and so a promotion of that would be beneficial to all. Staff training packages. Everyone was told us that they felt they got lots of training, but some people felt that it needed to include more lived experiences of service users, and also wider than just the mental health services. It would be good for there to be mental health awareness training generally and in all organisations, not just those specifically working with people with mental health. The crisis resolution home treatment team. So this is something that was very confusing for us as an organisation, and we feel that it's something that needs to be promoted and shared so that people know what it is and what it actually does. People felt that they needed more therapy, so they wanted more personal approach to their therapy. They felt that they were just medicated, and so that's something we would like to have a look, people to have a look at. And then peer mentors, so that is something that the PPL are working on at the moment. So what impact have we had? We have taken our findings to the NHS QSG, which is the Quality Surveillance Group, and ELFT have been put on enhanced surveillance. We currently hold bi-monthly safeguarding meetings with the leads from Luton CCG, Luton Dunstable Hospital, ELFT and other providers. We know that there is work on an admissions pack and a discharge pack at the moment for the inpatient wards. We also managed to get toilet seats reinstated on the ELFT wards. We made sure that when the election came up last December, that people, as in the staff, were aware of the access of rights to votes for inpatients and made sure that that was happening. And also there's been a redecoration programme has been agreed for the wards. So what next? We're going to continue to monitor our recommendations. We will continue to use our RAR and make sure that people who have committed to making change or have committed to take things further or adapt or work with us, that is happening. We will review our interim views in the near future. We will continue to report to the NHS QSG. We'll continue to sit with the CCG's contract monitoring, and we will also now try to gather more community views to support the mental health services, and we will carry out targeted engagement.
Good morning, my name's Chris Harvey, Head of Quality at Luton Clinical Commissioning Group. and I've been asked to comment on the working relationship between Healthwatch in Luton and also the quality team within the CCG. Over the last couple of years, we've expanded the amount of work that we do together, and that's included doing joint assurance site visits to our providers, be that the acute trust, community trusts or mental health trusts. But also we've made sure that we've met regularly and we've had forums whereby we can share concerns or actually share good practice as well, because it's important to recognise the good practice as well as areas that concern us. We've also invited Healthwatch to some of our quality meetings so that they can actually put across the views of the patient, the views of the Luton community to the provider themselves, and actually be involved in those really healthy discussions around how we improve upon the quality of care that we deliver to the community, to the patients and their families in Luton. I think what's worked really well is those site visits. So when we go as a CCG quality team to a provider to assess and get assurance in terms of the quality of care, we very much look at the clinical components and the clinical aspects and the clinical metrics, if you like, of the care that's being delivered. But what Healthwatch provide us with so richly is the patient's view. So they come with us, they speak to the patients, they get the patient's experience view, and then provide that into the completeness of the report that we get and that we share with our providers to ensure that we're actually acting upon what really matters to people, what really matters to patients when they're receiving care. What's been difficult, I suppose, in the last 6 months or so is the impact that COVID had on that. So we've had to postpone some of our site visits and pause the sort of site visit process. But as we start to now get back towards more business as usual, that's something that we will reinvigorate, relaunch, because we know that it really works and that it really matters to people. And that's how I see the future really for the quality team in Luton CCG and Healthwatch, just working together much more in the future so that we can share the intelligence that we both receive for the benefit of the communities in Luton. Thank you.
Hi everybody, my name is Kirstin Deer. I am the lead course coordinator for Luton and Bedfordshire Recovery College, which is part of the East London NHS Foundation Trust. We offer free courses for wellbeing for anyone living or working in Bedfordshire. We have been asked by the lovely Lucy from Healthwatch to come and talk to you about how we find working with Healthwatch. And I thought I'd take this opportunity to share what a fantastic organisation we think Healthwatch is. They provide a listening ear for people and allow us to hear what we wouldn't necessarily hear, so we can improve. They advocate for people so that they can get what they need. They are our critical friends, always providing warmth and encouragement to do more for our clients. And they know their clients and the people in Luton really, really well, and they understand the services and what's out there for people so that we can then be supporting and working together. I think the one of the key things that Healthwatch does is it advocates for people so that they are able to utilise their services better and feel more empowered to use those services to the best of their ability. But also allow people to understand what to expect from services and feel confident when maybe things don't go the way they want them to, and be able to then resolve those issues. In terms of working with them as a community organisation, working together with another community organisation, they are always the first organisation to be there, and they're always there to support us and support what helps the community to thrive and strive to be better. I wanted to say thank you, and thank you for asking us to do this little video. I hope this is what you wanted, and I'll say goodbye. Thank you. Bye bye.